Okay, very good. Good evening. This is Dr. John Bennett from Miami, Florida, having um, one of our hangout series on medical applications. We have the pleasure tonight of having an orthopedist from Pamplona, Spain, Gonzalo Mora. Gonzalo is a little interesting because he's an orthopedist he makes his own app, and he made an app called Insightmedi, which is essentially, from what I understand, a medical photo sharing app that's designed for medical education. And Gonzalo is going to talk to us about that tonight. So, bienvenidos, Gonzalo. Okay, Gonzalo, you ready to go? Gonzalo? Oh, I guess we're having some problem. Oh, okay. Yeah, I guess you can't hear me, Gonzalo, right?
Can you hear me, John?
Now I can hear you, yeah. Can you hear me, Gonzalo? I can hear you, but I guess you can't hear me. You can't hear me? You can't hear me, Gonzalo? Oh boy, oh boy, oh no. Okay.
Okay, can you hear me now?
Yeah, I can hear you fine. Can you hear me?
Oh, okay, perfect. Now it's okay. I don't know really what happened, but anyway.
Oh, you can hear me okay? You can
yeah.
hear me okay? Okay, Gonzalo, I'll just start again. I'll just start again because I can edit out the first part. I can just cut it out. Okay?
Okay.
Okay, I'll start again. Are you ready?
Yes. Can you see my screen?
Yeah, I can see a screen share. Yeah, I can see
Perfect.
the Insightmedi.
Okay, perfect.
Okay, here we go. Here we go. We'll start again, Gonzalo.
Yep.
10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Good evening. This is Dr. John Bennett from Miami, Florida. We have another hangout dealing with medical applications. We have the pleasure tonight of having Gonzalo Mora, MD. He's an orthopedist from Pamplona, Spain. Gonzalo is a little unusual in that he's an orthopedist who does his own programming. He actually constructed, I believe with the aid of some other programmer, this program, which is called Insightmedi, which is a medical photo sharing app designed for medical education. And Gonzalo is going to let us know about it and take us through exactly what that application is. So welcome, Gonzalo. It's all yours.
Thank you very much, John. Thank you, and good morning, good night. I don't know really what time is there in your country. So this is 12 at night and midnight, and I'm very happy for the possibility and the opportunity to share this experience. This has been really a very nice experience, the possibility to develop an app for the healthcare community. And the idea was very simple. 1.5 years ago, I decided that I want to share all my images, which are a lot of them, because I normally take lots of pictures from X-rays and from arthroscopy and from all different type of surgical procedures, and I wanted really to share all that information through images. I'm very passionate about photography, about mobile apps, about internet, and about new technology, and also about medical education. So what I did was really I tried to find some people interested in this topic also, and I started to build our app, which is nowadays available in the market in the Apple Store, which is Insightmedi. And this is our team. One of the doctors, this is me, another doctor who is also a very good friend of mine at the years at the medical school, and I also found two very good developers for the programming part, which I'm not an expert. I was the one who started designing the how the app has to work, and the idea was very simple. This is our mission in Insightmedi. We want to build a community for medical image sharing. We want to promote knowledge and promote interaction among professional healthcare providers. And at the same time, we want to provide relevant content. And what was the problem that we found? The problem that for people who works in the healthcare community, for healthcare professionals, well, we are always dealing with sensible information. At the same time, we are dealing with privacy restrictions, and we have a lot of information, but sometimes it's not really classified and not really filtered. And at the same time, from the pharmaceutical industry point of view, there is a limitation on marketing in general media, and also it's quite an effective marketing, the type of marketing they are using, because they try to market to all the people, and sometimes it's difficult to reach the professional people. So what we want to do is, from the healthcare professional point of view, is to build, we wanted to build a good app for a secure environment and quick access, so we decided to make it mobile from the beginning. And the most important part is that nowadays we have the information classified and with enriched content. As you can see in the image in this slide, you can have images, different type of images. In this case, is a knee arthroplasty, as I am an orthopedic surgeon. But you can also use tags. You can also use links in the image. So you can go from different type of information and to other type of content. And for the pharmaceutical industry also, we think that it may be useful, this type of tools, because they can have global access to professionals, and at the same time they can use it as a tool for segmented content marketing. And that's the main idea we have been working and developing. And we really wanted to do something like an Instagram for doctors, but not only an Instagram, because we think that sharing images is very important, but the most important is to be able to make really an app which is social and at the same time professional. So nowadays with Insightmedi, you can follow other colleagues, you can get in contact with other colleagues that are sharing their images at the same time, and all the images are filtered and classified in different topics, in systems, in anatomical regions, in specialties, so you can go direct to the information you really need and you really want. If I am an orthopedic surgeon, as a default, I get all the information from my specialty, but I can go through a filter option to any type of medical information. Yeah, sure.
You're still on the first slide. Is that okay, or did you want to move forward?
Well, yeah, I thought I had more. Sorry. Let
Okay.
me.
Well, I'm not sure if you wanted to stay in that first slide or not. I've made that mistake before.
Okay. Now you are. Can you see the second slide? No.
Not quite yet.
Okay. Right. I was. And now?
There you go. Yes, I see it now. Yes, I see it.
Okay.
I see
This is
your team there.
okay. Perfect. This
Yeah.
is this is my wonderful team, the one I presented previously, and this is four of us. One is me. Another one is one of my friends, and two other members of our team, which are the developers. And as I mentioned before, this is the type of images that we can see in Insightmedi. It's a very I think it's very nice point of view of the different images. You can see pathology images at this time in the application, and also you can use you can see like a detail of the images. As I mentioned before, you can have tags, you can have links with, and you can have text. So at the same time, you can share images with other colleagues, and you can also say that you like this app. Sorry, you like this image, and you can also make comments on the image. You can make questions to the colleague that has presented the app, the image. And there is a very important thing that, as I mentioned before, we wanted to do something like an Instagram for doctors. And not only doctors, but also all kind of healthcare professionals, because we realize that this is a very good tool for medical education, and we think it's very useful, and it's been very useful in Spain for also for students, medical students and nurse students and all people involved in healthcare. And one thing we really wanted to have, it was a professional tool. So as in comparison to Instagram, that where you can upload all kind of images, here in Insightmedi, all the images are reviewed by a professional team of doctors. So before they reach the community, we review one by one all the images. So we can assure that there is no private content, no name of any patient, no name of any hospital, and no identification numbers and something like that. Because we are very worried about, and a big concern is privacy, and we have to follow the HIPAA regulations and also the European and other country regulations around the world. So this is a topic that has been designed very intensively, so we can assure now that we are really HIPAA compliant and also European regulations compliance. So that's the main idea of Insightmedi, and I would like to try to make a demo of the app. So let's try to share another. Let me try to share another possibility, another.
Okay.
Yeah, I'm going to. Okay, 1, 2, 3. We can make a cut in the middle.
Okay. It's not screen sharing.
Uh, Let me try.
Okay, let's give it a try. If not, we'll work around it.
It should be. Can you see it? No, not yet.
Not yet. Not yet. It's okay.
I don't know. Probably having both the Google Hangout and the program I use for reflection. Let me try again. I'm going to try to mirror. It should be working now.
Well, maybe you could. Is it on the net? I could probably try to screen share it if I knew the address, um, or can we just describe what you mean? Would that be possible?
Yeah, just give me one second to try again, just in case.
Okay.
Uh, it must be working.
Okay. Yeah, the program does have its bugs, that's for sure. And once
Mhm.
you go off the screen share once, it acts funny sometimes.
Yeah. Uh, okay, again, MacBook Air. It should be working, but anyway, okay.
Okay. Okay.
I
Just
think I would like to invite all the people who want to listen this hangout to share and to use, mainly to use the app because they have the possibility to see, first of all, to see very good pictures of people who is sharing. And the idea is that it's people from all over the world. So it's very nice to share information and to share knowledge with people from different countries, and at the same time you can realize that how other people in other countries treat the same problem and how other people see uh, different type of pathology that you can see in your country. So the main issue is that, well, you can use also the language you want. It's translated in English and Spanish mainly, and we are trying to make also extensible to other languages like other languages in Europe. But the main idea is to be able to share medical information for healthcare professional in a professional network. It is not meant to be for patients. It is not meant to be a diagnostic tool because diagnosis is the responsibility of the professional. But it's meant to be a tool to help to spread the medical knowledge and also to be able to get advice from other colleagues in some pathologies that you may not be an expert at that time or you may need some advice at that time.
okay. Well, very good, Gonzalo, and thank you for being patient with the technology.
Yeah,
now, now, certainly, I think probably Spain is very much like America. Yeah, and you mentioned is designed for mobile devices. You know, in America, I know that when I go on the subway here, 50% of the people have smartphones, and I'm sure students are the same way as far as what they use for education devices. Of course, when you and I went to school, it wasn't around the smartphone, but now it's a very convenient way to look at X-rays and to look at slides and to look at medical pictures. And certainly, of course, your desktop is always good, but it's nice to have the option to look at medical pictures on the smartphone. Now, it's very common in Spain too, correct? Everyone has a
yeah.
smartphone?
I can see you. I
Yeah.
can show
Yeah.
you. Can you see the app here?
Yeah, yeah, I can see it. Yes, yes.
You can see ECGs, you can see X-rays, you can see, well, different type of images from different type of doctors, and we can also look for, as I can show you here, you can look for a specialty, different type of specialties. Let's say anatomy, for instance, and you will
Uh-huh.
see images from anatomy, and also you can see the images from this format. So they are very nice. You can see, let's see this nice image. Now probably
Mhm.
the net here, you can see the image. I can
Yes.
make it bigger. I can expand the picture. I can view the detail. Can you see it? Yeah.
Yes. Yes.
And so that's the idea, to be able to share information with colleagues in special topics. Now I'm looking at anatomy images, but I can go for also for orthopedics, or I can also see from systems, and I can also see from anatomical regions. I can decide, well, I want to see just from the upper limb, from the lower limb, from the thorax, from the back, or whatever. So it's very easy and very funny to go through the app and through all the images.
It's all a vertical scroll, Gonzalo, or it's all vertical scroll, correct? It's not horizontal.
Yes, it is designed for vertical scroll, although when you see
Yeah.
one image, let's see, when you see one
Yeah.
of the images, we can make also, let's see, this is an anatomy of the foot. If I go here, I can also put it there. So it's gonna be
Okay.
in this position when I want to turn it horizontal, or when I want to make it vertical. But just for the detailed view of the image. When I go back, the main view it's always horizontal. So we don't have to make very different aspects. It's very convenient in this way. We have realized that most of the pictures look better in this position, but if you want in horizontal, it's not a big problem.
Well, Gonzalo, now is probably not the important time to say how Google is so great because of the slight problems we had with the tech of the Hangout. But when they designed Google Plus, it took me a long time to figure out that Google Plus was designed for vertical scrolling. And
Oh,
I don't know if they knew, I don't know if they knew ahead of time that mobile technology would be so important. But Google Plus fits perfectly into a mobile type of situation because of that fact. It's a vertical scroll. It's very easy to slide pictures up and down on your smartphone, and that's a fantastic and bad advantage of the Google Plus, the vertical scroll.
hmm
You mentioned, of course, the first question that came to my mind when you mentioned the purpose of the app, of course, is the security and the privacy, and you've already addressed that question. And certainly, I'm sure there's an equivalent of HIPAA in Spain, correct?
yeah, it is. It's a
It's a different
European. Yeah,
it's a
well, it's almost the
European.
same. Yeah, it's a European regulation. It is very similar to the HIPAA regulations, and most of them, and I have also been looking for other international regulations in Asia and Africa and other continents, and they are very similar. And at the end, what they look for is not to give information of the patient away from the patient. I mean, not to give the identity of the patient to other people who may not know that patient. And the idea is always the same: is not to give that information to the world, just to keep it in
Right.
private, because some people may want not to share their problems. And at the same time, whenever you take a picture from a patient, where you as a doctor or as a healthcare professional, as you know, we have to have the permission of the patient. We
Right.
can't share images without the permission of the patient.
Okay. How about if a doctor had a question? Suppose he had an X-ray of the hip and he wasn't sure whether it was an occult fracture or whatever. I guess he's not permitted to send that on the internet, or does he have to blacken out the patient name, or do you frown upon that, or it's not for that purpose to like get a second opinion of a study?
Well, it's not really for patients getting a second opinion. That's not the idea.
Okay.
The idea is also for a second opinion from a professional. We try to make and to have all the users as much as possible verified, because we want to be sure that if I say I am a doctor and I am an orthopedic surgeon, we want to be sure that this is right. As you may know, this is not always possible 100% of the time, but that's the idea we want. And at the same time, we have also a built-in editor into the app that gives us the possibility to cut numbers, to cut names in the app. So that's a big idea, because it's forbidden for us to put names and to put any type of identification, but at the same time we have to offer the user the possibility to do it in an easy way. So we built an editor into the same app, so you don't really need to do something before in the photo you have. You can edit it in the same app.
Well, you know, it's accepted in the iTunes store, right? You can download it for free in the iTunes store.
Yeah, completely free.
Now, there's no question about HIPAA compliancy there, correct? They accept it as just educational, correct?
Yeah, that's it. And
now, do you have plans in the future?
Sorry.
I'm sorry, go ahead.
Yeah, we were very lucky, because normally in this type of apps, Apple is very reluctant to accept if they don't see that everything is right. And we were really lucky, and at the same time, because we were accepted in just 4 days, which is really a record in an app, in a medical app, to be accepted by Apple. We are now in version number 2.2. So, and we haven't had any problem in Apple, and any rejection and any other problems. And we always gave them the information that the app was HIPAA compliant and also European regulations compliant.
Are there any plans at all to make it a secure HIPAA compliant app, or no? It's strictly, you want to stay educational and that's it?
Yeah, mainly educational, and to be reachable by students and by other colleagues. The idea is to make it social, so students can share information also with high top specialists and other doctors with lots of experience. So not to make it really close just for doctors, but open to other healthcare professionals. And the plans we have, yeah, sorry.
Now you said they're reviewed by doctors. All the slides, all the films are reviewed by doctors.
Yeah.
Now, do they put labels or interpretations of the pictures and slides, or
No.
do they put any kind of script, or just strictly the picture and the slide and the extra?
Yeah. What we really only review that the picture is compliant with the regulations, and that the text that is placed in the picture is compliant with the regulation. I mean, we can't accept any data from the patient in the image, but also we can't accept it in any data from the patient in the text they place. We can talk about pathologies and things like that, but we can't write any data of the patient. So that's what we review in the review process, but we don't try to make a comment. Everybody can make a comment, but as a reviewers, we wait for the comment of the doctors and people using the app.
Are people allowed the option of making a comment about a certain study, or strictly viewing?
No, everybody has every user has the possibility to make a comment, to make a question, and to give their opinion on the image and on the pathology if they do not agree with the diagnosis or things like that.
Oh wow,
and
that's a good option.
Yeah, and at the same time, every user has the option to report something in the image if they consider it is not appropriate by any reason. So whenever any user makes a report, we review again
Okay.
that image. So if we consider that the user is right, we can remove the image from the database.
So you're essentially crowdsourcing the
Yeah,
medical knowledge of the world.
that's the idea, real.
Well, that's a good idea. Uh, you know, did you mention? I may have missed it, Gonzalo. It's in Spanish and English, or other languages, or Spanish and English.
Well, at this moment, it is in Spanish, English, and also in Catalan, which is a language which is talked in Spain also. We are planning to translate it to France, to French, sorry, German, Japanese, Chinese, and Russian at the moment.
Wow. Okay. And it's designed mostly for healthcare professionals. I think you
Yeah,
may have mentioned that.
yeah. It's the idea is only for healthcare professionals and also for students of all healthcare professionals specialties. Not only doctors, but nurses, but chiropractors, podiatrists, any type of people who may be interested in using as a professional.
You know, Gonzalo, you showed us a picture of your team. What role did you play in making this app? You yourself. Do you have a background in programming or web design, or
Well,
what kind of background do you have? It's unusual
uh,
for an orthopedist to be involved in an application.
yes, it is. I like programming, but my experience is not very big because I've been doing little programming since I was at the high school with different languages, Visual Basic and things like that. And after I went for HTML from something in the web and things like that. And 2 years ago, I decided I wanted to learn to program an in iOS system, and I joined one of the courses available in Spain, and I realized that first of all I was the only doctor in that course. Second, I was really low with a low level of programming, so I decided instead of going very slowly trying to learn the programming language, I decided to, to talk with people who are really good at programming and to make a team, a really good team. So nowadays in our team, the doctors are doing the part of that the doctors can do, and the engineers are doing the programming, and that's what they are really doing really well. So we try to make each of us are trying to make what we really know to do.
Well, you know, it's the same principle in medicine. You
Yeah,
know, there's only so much you can do, and sometimes you have to consult a specialist um, to do a really good job, essentially. Because as you probably know, in the old days, probably the same in Spain, orthopedics was handled by general surgeons.
yeah,
But of course, nowadays, you know, orthopedists do the bone work, which is only right because
yeah.
you want to have someone that does it all day long and that trains in it. But do you have any plans, Gonzalo, to do any other apps, or are you going to refine this app and continue to improve it, or any
Yeah.
plans in the future?
Well, part of the plan is doing the Android version, which is has been asked by many users that don't have an iPhone or an iPad, and we are also planning to do a web version. So we would like to have three versions: one in iOS system for Apple, in Android for Android devices, and also in web. And at the same time, we want to make in the future, not now because it takes a lot of time and effort. And also, we are looking for partnerships with other colleagues in around the world who may be interested in that. And also looking for investors because we need money to keep on doing the and developing the app. It takes a lot of time, a lot of money also to develop in such a good quality of apps and a lot of effort. And as you know, we as doctors we don't have all the day free to be doing this type of things, so we have to be with our patients and in the office, in the operating room, and at the same time having meetings with our developers and engineers. So it takes a lot of time and effort and money also.
A quick question from the audience, Gonzalo. I believe, let me see here. Could engineers use this app to better understand pathology when designing medical devices?
Can you explain that? If they can use it?
Like engineers, like you think it would help, like suppose someone was going to design a medical device for the heart, and a non-medical, like an engineer, not a medical student, but an engineer. Would he be able to get some insight as far as the anatomy or whatever to design that medical device?
Yeah, I think it's very important. I've been involved in other research projects a few years before in virtual reality, in arthroscopy and things like that. And I was the only doctor at that team. And it was very important for me to teach the engineers about things on anatomy and things like that in pathology, because it's easier for them to understand what they are going to develop later, because it's of course it's difficult. They are not going to be doctors, but at least they need some knowledge to be ready to develop good products to be used by professionals. Because if they don't understand anything about what we use to do and what type of information we need, they will probably not be able to help us as much as they can if they know something about.
Well, Gonzalo, that's one of the exciting things about being in medicine today. We have so many scientists that before they would work on the space program or other types of things, but now a lot of them are working on medicine and working on medical devices, and they're working on big data, genomics. Bioengineers, we're getting a lot of brains now concentrating on medicine. So we're getting a lot of help from allied sciences and allied fields.
Yeah, and I think for me it's been a great experience to work with engineers, because we as doctors and healthcare professionals are very focused on trying to solve very quickly different problems for our patients. But they are also, the engineers are very focused on solving big problems with more time and more dedication, and also they are more focused on the job they do, because they normally used to get milestones and step by step. So it's been very funny for me, and also very useful. I have learned a lot from my engineers, and I think it's been also useful for my medical daily activity, because now I am much more effective on the things I do, and also on even in time management. They are very effective in time management, at least compared with medical students, and I think that's been very useful for me also.
Okay, thank you, Gonzalo. There's another question, but I think you already answered that. Someone asked, is it also available on the Android? And you said you were working on that, correct?
Yeah, that's it. It's not yet available, but it will be in the next few months.
Does that take a lot of programming to do something like that, or is it just minor work, or is it a lot of programming?
You mean going to another version for the Android, or just for this type of app?
No, just to go to something that's compatible for the iTunes store, and then have it make it compatible for Android. Is that a lot of work? Do you do a lot of changes in the program?
No, the idea is not to make really changes in the program. To be very similar the Android app and the Apple or iOS app. But the problem is that it's a very high complex app because we have to deal with database, with images, with filter, with classification, with different options, and it's not a very simple app. So it takes a lot of effort, and at the same time, our engineers are working with another team of Android developers trying to help us, but it's not an easy task to be done in just a few weeks. It takes, sometimes it may take at least 8 to 10 weeks to do it really in a good way.
You know, Gonzalo, you mentioned about how you cover a lot of areas and probably a lot of parts of the body and a lot of specialty. Is it organized into specialties too, or mostly anatomy on different parts of the
No,
body?
we really have three levels of filter and classification. Each image is associated with a specialty, even subspecialty also. Each image is associated with system, which may be, say, respiratory, cardiac, musculoskeletal, or whatever. And also it's associated with an anatomical region. So you can't find any loose image. Every image is associated at least with these three options. So whenever you look for anatomy, you can look for anatomy of the lower limb, of the upper limb, of the chest, and at the same time you can look for anatomy of only the musculoskeletal system and of the lower limb. And even you have a fourth level of classification, which is by tags. Using tags like hashtags in Twitter, you can also classify different images with the same tag, so you can join this type of topics. Or even a case, you can use a special tag for a case, so you can place different images associated with this same case.
Well, you know, Gonzalo, I don't know if you're like me, but I almost wish I was starting medical school again. You know, I think I could learn a lot more with the smartphone, a lot more,
Yeah,
a lot of exciting things happening in medicine. And I know that you're involved with other things in medicine, such as stem cell
yeah,
research. But we'll try to cover that again in another hangout. I'm certainly
perfect.
very curious about
Yeah.
hearing about that. And I'll try to get you some guests or people in the panel that you might think that are appropriate that could add to the discussion. But I thank you very much, Gonzalo, for being patient with the technical problems we have. And
No.
I thank you for staying up late in Spain. I know it's past midnight in Spain.
Yeah, it
So,
is.
do you have any early OR cases tomorrow?
Okay, thank you very much
Okay,
for this
Gonzalo.
experience.
Okay, hang on. I'm gonna talk to you after we end. Okay. Good night.
Okay,
Hold
good
on.
night.